I too was impressed with the reference to the new kids on the block. I thought that was good myself too, rather than all this terminology. And also the good, bad and ugly. So that was good. Just a very small question for my wife here, in actual fact. I'm speaking on her behalf. And she was wondering, as she is on Ocrteotide, 30 milligram, as to what the maximum dose is. I mean, is she only just on the beginning of the scale, or halfway, or is she getting a high dosage?
What is the maximum dose of, I can use both, either sandostatin or somatulin? There's no maximum dose practically. So however, there are some limitations on what we do. So according to what the companies that are producing these drugs are saying, the maximum dose should be 30 milligrams every 28 days, or 120 every 28 days. There are several strategies if the patient has got refractory carcinoid syndrome symptoms before we move to these new kids of the block. And these are the following. First of all, we need to demonstrate whether, for example, diarrhea is due to ongoing carcinoid syndrome or due to injections themselves. In that case, the patient needs creon, not more injection, because more injection will give more diarrhea. So if we demonstrate that diarrhea and flushing are due to hormones, how? By doing a 24-hour collection of 5-HAA, which is usually high. Then we ask the patient the following question. Are these symptoms more prominent during the last week of your injection? And if yes, it is common practice by many physicians to bring the injection onto 3 weeks. If it's not the case, and the patient has got refractory carcinoid syndrome symptoms during the whole month, then some physicians go up to 40 milligrams of octreotide. I would suggest that if it is the case, the patient should escalate treatment. And nowadays, I would suggest the patient to go into the new clinical trials, because this SOM230 injection or the other lexicon drug could be helpful. I wouldn't use one sandostatin injection per day. And even for tumor control, Novartis, which is making the sandostatin, used in a trial 4 years ago these oncolar injections, 160 milligrams per month, huge, to see whether they can control the tumors better. No success. So it seems that even if you use one LAR injection per day or one somatolin a day, you're not sorting out the problem. The physician should make a decision to escalate the treatment.